Some people have low back tension because it's related to an injury. It could be genetic related. There's a lot of different things. But for some people, their low back tension is just part of being a human. We're on 2 feet, we're upright, and we have gravity acting down on our spine. So what I want to do in this video is talk about 4 stretches to help unwind your spine. And what I mean by that is to loosen up some of that tension in the low back if you have that low back tension. So we're going to talk about 4 different movements. One is going to be the rotation of the spine, one's going to be side bending of the spine, and then flexion and extension of the spine. So we're going to get all 4 ranges, but we're going to try to do these stretches that are going to be safe and accessible to most people. So first stretch, let's talk about rotation and what that could look like. I like this particular stretch because it's very effective and you don't have to lay on the floor to do it. You'll notice I've got something here to put against the wall and my knee. The knee that's down is the knee that is against the wall. I want this here because I want to press my knee into it. If we don't do that, what can happen is we come here, we open up through our hips, and now you're not going to get the effectiveness of the stretch. So we keep our knee tucked in here and we open. We open, we open. Wherever you stop is okay, because the idea is mobility. You don't necessarily need to be more and more and more flexible, although that can be okay. But for most people with low back tension, it's more coming in and out. Gentle is key for most people. You don't need the aggressive stretches. And as you go a little bit more and a little bit more, each time you might get a little bit further. Here's the most important thing, and that is symmetry. For a lot of people, they stretch the one side that they have the pain on, but sometimes that's not necessarily where they need to be stretching. Sometimes it's the opposite side. So for example, say the first side, I got all of that range in there, and then the second side, which I never check in with, I'm like, oh, wow, I just stopped here and I can't get past that. It takes a lot of effort. So check in with both sides and shoot for symmetry. Again, keep that knee pressed in. So let's take a look at the other stretch. Your other stretch is going to be more for side bending. For this one here, what I really like is to use a big breath in. The reason we want to take a big breath in is because when I take a big breath in, I am inflating my lungs and I'm pulling my diaphragm down. It's kind of like blowing up a balloon. I'm going to make the space in here bigger so that when I do my side stretches, I'm going to get a lot more areas. Because for a lot of people with low back tension, it's actually restrictions in their rib cage and their mid back that they need stretched. So I take my breath in, all the way in, and then I hold that breath as I reach up to the sky. I don't want my elbow bent like this here and doing something like this. I'm not trying to do this. Big breath in, reach, and then jut my rib cage over to the side. And then same idea, you would check in with both sides. How long do you hold that? How long can you hold your breath? Can you hold it for 2 minutes? I'm kidding, don't hold your breath for 2 minutes. Usually 10 seconds is pretty good for these. So 10 seconds, go to the other side, but then do it a few times on each side. Don't pass out on me. Let's look at our flexion and extension stretches. If you've done yoga before, you're familiar with these because these are the beginning of almost every yoga class. And these are your cat and your camel, or your cat and your cow, a lot of people call them. I'm just going to show you a couple little additional things that I like with these. So with the cat stretch, I always say a cat's the most agile creature on the planet, so let's stretch more like a cat sometimes. And that's going to be coming up like that. And then our cow, they call it the cow because it's kind of like a cow belly. And we're going to come down here. Now, this same idea, mobility is what's important. Meaning I'm not trying to push as hard as I can and just stretch through anything. I'm trying to do this 6, 8, even 10 times back and forth. Going for mobility, it doesn't have to be deep. Now I told you I was going to teach you a little trick, and that's going to be stretching the front stomach muscles. Now you might be thinking, but aren't I supposed to be getting my front stomach muscles stronger and tighter? Sometimes for some people, but half of the time, people with chronic low back tension, their front stomach muscles are actually too tight. They do need help in their side stomach muscles, but they need to stretch in through the stomach muscles here. Because if they're tight in the stomach muscles, that can do a couple of things. Let me show you this first. If your stomach muscles are too tight, it can either just pull us forward like this, we create more tension in that low back, or we're too tight here, we know, oh, we got to get upright, so we throw our hips forward. They call this a sway back posture. This is exaggerated. Most people aren't going to be this exaggerated, but you've probably seen people before that kind of have this type of a stance, like why are they standing like that? And sometimes they're too tight in their stomach muscles. So let me show you how you can fix that. We're going to be here, use that big breath in again. Breath in, press the belly out, and then do that, and you should feel a big stretch in there. So there are your 4 stretches. We talked about rotation, we talked about side bending, and we talked about flexion and extension. Couple things to keep in mind. Some people are so stiff, restricted, and tight that they need to see a chiropractor for manual therapies or even some alignments and adjustments. The added value of doing something like that is they can show you custom specific exercises for you. If you have an actual injury, you absolutely want to see somebody about that, because although these stretches are safe and they're probably not going to harm anything, you might need something additional, some additional therapy. So hopefully you got something out of that. Let us know in the comments below how you like these stretches, if they're working for you. If you like the video, give us the thumbs up, and we're always looking for good questions or more ideas for videos for you.